I'm Dr. Jeff Schels with Advanced Chiropractic, and today we're going to go over how to use the low back or lumbar Denneroll traction device. So if it was recommended that you use this, it's because there's not enough curve in that lower part of your spine. So from the front, your spine should be straight, but from the side, it should have curves. And if you're using this, you don't have enough curve down there. So what this traction device does is when you lay on it, this helps to establish more of a curve in that lower part of the spine over a period of time. So we're going to go over exactly how that works, and we're going to demonstrate how to use it. So the way that it works is you'll lay on it, and this side here faces down or points towards your feet, and you'll sit and then slowly lay back to where this lip is right here in the small of your back, the middle part of that lower spine, where the curve is at its most. So you'll lay back until it's in there, and then you just lay back right over the Denneroll so that it's pressing in, putting tension on the ligaments in the front of the spine to help get more of a curve through there. And as you do that, the way that it works is once you lay back, the ligaments that run along the front of the spine here, over time, if your spine is not curved enough and you need to have more curve, this ligament has to get longer. So once you lay down, it puts tension on the ligament, but it doesn't initially lengthen. After 10 minutes, it starts to lengthen, and it lengthens for a total of 10 minutes. So even though when you first start, you only do it 3 minutes, and then the next day you go to 4 minutes, you add 1 minute a day until you get to 20 minutes, it doesn't even really begin working until after 10 minutes. But there's no advantage to doing it more than 20 minutes because it won't lengthen any longer. So you do that 5 days a week, 20 minutes, 5 days a week is gonna be the key, all right? So now we're gonna actually demonstrate how to do that. I'll have Nancy come right on over. And the first thing is you'll sit down and then face that direction, and you'll put it all the way back here so that when you lay back, you'll want that lip to be right here in the small of the back. Okay, so slowly lay back. There you go. And I'm gonna go a little lower on that. There we go, that's good. And then slowly lay back now, and it should be right there in the small of the back. Now, if you wanna use a little pillow to support your neck, that's no problem at all. And some patients will have some, and it'll be a little bit of discomfort. You can bend your knees a little bit on this one, but not much, if that helps, okay? So once you lay down like this, you just lay on that for 20 minutes. Of course, you work up to 20 minutes, and that over time will help put more of a curve in that lower part of the spine. If at any point you have too much pain, now you would expect some discomfort whenever you're actually changing the shape of the spine, but if it's too much discomfort or if it's real sharp pain, you'll want to discontinue, but make sure you talk to your doctor about that. Now, when you go to get up, what you don't want to do is just sit up, because that usually will be too painful. So you'll instead slowly roll off as you bring your legs up. And that's how you do it. So if you have any difficulties, make sure you talk to your doctor about that. Otherwise, we wish you the very best of luck, and we'll see you on your next appointment.